the BMA because we've had a view now of the RCP. So,
well, I mean, Wales has led on denormalising smoking. We know that children are heavily influenced by imagery. We know that the portrayal of smoking in films by famous film stars will have influenced the behaviour of children, and we know they're heavily influenced by role models. We just don't know whether that would translate into normalising the uptake in children. And if you asked me, would I be happy with my 11-year-old son sitting with an e-cigarette, I'd have to say, no, I would not. We have to find a way of preventing smoking uptake. We don't know enough about the behaviour. We're very early into the research. As far as I know, there's only one paper from America that started to look longitudinally at taking non-smokers and what happens next. I think until we know exactly what the risks are, I would urge caution. I absolutely agree with the Royal College of Physicians in terms of harm reduction. There is a very real role for e-cigarettes. We are worried about the uptake in our children. Wales has an opportunity to lead on this.
So how would you see e-cigarettes regulated?
Well, I think part of that is to do with their availability. I think the less that someone observes the use of something, the less normal it is becomes. I think that anything on sale to the public should have some form of label as to what its contents are. And the reality is that we just don't know what the contents of many of these e-cigarettes is.
Do you believe there should be any, question to all of you, really, do you believe there should be regulation in terms of their use at all, the ability to buy them, the ability to sales and marketing? Do you think any of that should be regulated?
Yes, the college has categorically said that it should ban the selling of these things to people under the age of 18. I mean, it's very emotive to say you're 11 or 12 or 13-year-old puffing away. Nobody wants that at all. That's not the issue. The issue is whether grown-ups, if you like, people over the 18, should be allowed to smoke these e-cigarettes in a public place if they're using them as a mechanism to give up smoking. Now, I've been in clinical practice for nearly 40 years. When I manage to persuade people to give up smoking, I like to take the credit. It's not my credit. If you ask people why they give up smoking, it's very complex. It's fiscal, it's information, society, peer pressure. There's a whole complex number of things. And it's the same thing when people start smoking. It is very complex, this behavior, and you can't break it down to simple things like watching an adult puff on a... So, you know, unless there's evidence for this, I think we have to confine our legislation to evidence-based and proportionate response to this. Now, talking about kids smoking vaping is the motive, and it doesn't add to the argument at all, because they shouldn't be available to people under the age of 18.
So how else would you regulate? You've said 18, but how else would you seek to regulate e-cigarettes?
Well, if they were to become under medicinal thing, then it would be illogical to ban them in public. It's like saying you can't take your inhaler for angina in public, you can't take your asthma inhaler. But I think there are lots of regulation you can do as to who they should be allowed to sell it to. Perhaps, you know, I'm just speaking at the top of my head now, but it should be for current smokers, for example, to help them. Many people are able to give up smoking by going to quit smoking programs, but many people aren't. They are addicted to nicotine, and this can be a useful way of harm reduction and transitioning down from cigarettes to e-vape.
So how do you feel about, because that's not, of course, what an e-cigarette is. It's a nicotine-based product which is sold and manufactured and produced for enjoyment purposes. It's not produced as a smoking cessation tool or medicine. It's not what it is. Manufacturers are very clear about that. So, and I find it quite interesting that you see it simply in those terms. And well, that's fine, but it is a much wider product than that. It isn't simply a product that is available to smokers. I presume you're not saying that sales should be banned to people who don't smoke.
The evidence at the moment suggests that the overwhelming people who use these e-cigarettes are current smokers. That's the point.
Okay.
Now, whether you can regulate to stop extending that to non-smokers, that's something I don't feel confident on commenting on.
Okay. But can I also make one point? You indicated that the children shouldn't smoke e-cigarettes. Well, unfortunately, children aren't allowed to buy cigarettes, but they do smoke cigarettes. So it's a question of how can we stop?
Well, it's the same with drugs, illicit drugs, and where do you stop? I mean,
So,
kids
Kirsty?
get hold of these things.
Thank you. Could I begin, Dr. Rees, by saying thank you very much for your comments about Tier 3 services. It's very disappointing. This committee spent a great deal of time looking at access to bariatric surgery, and we were promised that there would be improvements to Tier 3 services, and it's disappointing to see that that hasn't come to fruition. If I could move on to the issue of the e-cigarettes. BMA, in your paper, you say that you have concerns that the normalcy of smoking behaviour is being reinforced by the availability of these products. Yet we heard quite categorically from our evidence this morning from ASH and from Cancer Research UK, certainly two organisations that couldn't be accused of being apologists for the tobacco industry, that there is, in their view, no evidence to support that concern, legitimate concern, that young people who are not smoking are using these products in large numbers, and if they do start to use these products, then move on to using traditional tobacco products, which all of us here agreed we need to stop. And in fact, the evidence in England is the number of young people using tobacco legally, over the age of 18, is actually dropping. And that's where the biggest drop in smoking is occurring, is actually in the younger age group. And some of that, they believe, could be attributed to the availability of these new products. How does the views of Cancer Research UK and ASH this morning, as well as people who have done work for Public Health England, coincide with your assertion in your paper that this is happening, that normalcy of smoking is being reinforced by the availability of these products?
Yeah. I think it comes back to the point we've already raised, is that the evidence is so limited, it's incredibly difficult to say categorically either way. And I so wasn't here to hear the evidence of others earlier, so I can't comment specifically on it. But we're only, e-cigarettes are relatively new, and we're only just starting in, for example, our social attitude surveys and so on, asking about e-cigarettes. We're going to be another couple of years before we really get any idea of how young people are using them. I think there's another important point to be made about tobacco use and nicotine use as well. Remember, it's the nicotine that's the addictive property in tobacco. Is they were referring to over 18s. What we know is that the people who are addicted and stay addicted to cigarettes start smoking between the age of 11 and 14. That's when people pick up. So although it would be illegal to sell tobacco products to these people, that's when people begin to get addicted.
But I'm sure you would take a point that nobody in this committee is advocating selling e-cigarettes to those below the age of 18. Nobody is arguing that. It seems to me a lot of your concern, quite rightly, is about nicotine being an addictive substance. And I'm certainly aware, and we heard this morning, that there is only so much nicotine an individual can tolerate before it makes them, really unwell. I'm just wondering if the addictive nature of nicotine is your source of concern in trying to stop people using a product which is addictive. Forgive my ignorance, but on a level of caffeine or other substances that human beings imbibe and can become addicted to, sugar, caffeine, other stimulants that people take, how damaging to people's health is nicotine in comparison with caffeine, sugar, other things that people become addicted to?
Well, I mean, part of its problem is it's almost ubiquitous as a neurotransmitter. I mean, if you want to terrorise medical students, you talk about the autonomic nervous system and the kind of receptors, the way that nerves work. It's the nicotinic receptors are responsible for the end point of how our muscles work. They also act in the brain by releasing dopamine, which makes you inherently feel better about yourself. The very nature of the way they work is that you develop tolerance to them, so you need higher and higher doses for that effect. So although you may get the side effects at one dose one day, we don't know whether that will remain throughout. You know, it took 30 or 40 years for us to realise that there was a problem with cigarette smoke. We have, I mean, as you know, I'm an obstetrician. We've made some horrendously bad decisions about not regulating drugs and medicines in the past. And in fact, the Americans were the only ones who didn't suffer from the thalidomide problem because someone said we don't have the evidence of safety.
Can I ask the RCP about their view of nicotine vis-a-vis alcohol? You know, alcohol affects our dopamine, doesn't it? Makes us feel better about ourselves. Caffeine, sugar. I mean, I'm just trying to get a gauge of, you know, as a substance itself, how does nicotine compare with other things that human beings use?
Well, alcohol,
become
caffeine,
addicted to
cannabis, you know, I can't say I'm an expert on this, but I was at the Council of the RCP's debate about this, and we had some experts we may have had this morning giving evidence as well. In terms of the relative risk, of course, of smoking versus, it's a big difference. Now, there's no doubt you can get addicted, but there are a lot of things that are addictive. We've already said even sugar. I mean, looking at the latest Jamie Oliver, I would have thought there'd be far more compelling need to legislate for restriction of sugar in soft drinks than there would be for nicotine in these things in terms of the evidence that's available. So in terms of relative risk, I can't give you a straight answer, other than being addicted to anything is not a great idea, is it?